I am going to talk about the field of bioethics relating to medical ethics, specifically the beneficence versus autonomy issue. I chose this topic because I think it is the closest to each one of us, considering that we all need medical attention at some point in our life. I also believe this is an important field because many times in medical practice it is difficult to establish what decision is the ethical one. Ideally, for a medical action to be considered ethical, it must respect all four basic ethical principles: autonomy, justice, beneficence, and non-maleficence. However, this principle code is not always black and white. One of the first gray areas that comes up is the battle between autonomy and beneficence. The principle of beneficence establishes the obligation of the doctor to act according to what's best for the patient, while the principle of autonomy defends the patient's right to decide and dispose about all that corresponds to his body. Some of the most common and difficult ethical issues in medical practice is when the patient autonomous decisions conflicts with the physician's beneficent duty to look out for the patient's best interest, like when a person doesn't want a treatment because of religious or cultural views. For example, a Jehovah's Witness could refuse a potentially life-saving blood transfusion. The Jehovah's Witness does not want to die, but he is willing to do so because of a religious convictions. In this case, the respect of a patient's wishes can conflict with the doctor's obligation to help and not to harm the patient. So, even though in theory both principles are equally important, in cases like this comes the necessity to establish some hierarchy between them. In order to do that, it is necessary for the doctor to ask himself the following questions. Does the patient have the capacity to make decisions? Does the patient understand the risks and benefits of the available options? Can he or she relate his or her decisions to certain stable values? In cases like this, it is clear the principle of autonomy should prevail over the principle of beneficence, since it is not only about what is good for the patient from a medical point of view, but about what the patient considers to be good for himself and what is consistent with her or his values.